Okay, so the 5 places that you would give an IM injection are the deltoid, which would start, you would give it between the Ackerman process and the axillary fold, in between there, right in the middle. For the thighs, it would be the rectus femoris, which is on the top of the thigh. It's going to be in between the knee and the greater trochanter. And then on the side of the thigh, that muscle right there is going to be the vastus lataris, which is again going to be from your knee to your greater trochanter. You give it in between there. And then you would have your dorsogluteal, which is on the back side of the body. That is going to be in between your posterior iliac spine and your greater trochanter. And then you're going to have your ventrogluteal, which is going to be like kind of on your hip right here. And the way you're going to find that is you're going to put the palm of your hand on your greater trochanter, and then you're going to take your index finger and point it towards your anterior superior iliac spine, and then you're going to take your middle finger and point it towards your iliac crest. It's going to make a V, and then you're going to give the injection right in the middle of the V. Okay, so I would check the doctor's orders, the MRA, and then I would also check for allergies of any sort. I would check when the patient had the medication last, if they had the medication last, and where they had it at, and if it is safe to give, which it is. That I'm going to say that they had it at 0600. It was given in the rectus femoris last, so it is safe to give it again. I'm going to give it in the deltoid area this time. Okay. Anything else that I need to check? I think that's it. Okay, so I would wash my hands and put on gloves. I would gather my supplies. In doing that, I would grab the vial. I would grab the needle that I need to administer the medication with, and then I would get a 3 milliliter syringe and a sterile swab. 3 ways that I need to check the medication before I can give it to the patient is when I pull it from the area that it stays in. I need to check it with the MAR. After I fill up my syringe with the medication, I need to check the MAR to make sure it's correct. And then right before I give it to the patient, I need to check again to see if I have the correct medication. Okay, so now I'm going to do calculations. The order is morphine 7.5 milligram, IM PRN, which is as needed. The vial says 5 milligrams per milliliter, so I will need to calculate this out, pull it into the okay. So there is my calculations, and it is 1.5 milliliters that I'm going to administer of morphine. Okay, so that is done. Alright, so I've already washed my hands and put on some gloves. So next I'm going to check the expiration date on the vial to make sure it's not expired. I'm going to check the vial all over to make sure there's no damages or no leaks from the vial. I will take the cap off of the vial. I will take my sterile alcohol swab. I'm just going to pretend to rip it open and take it out. And then I'm going to wipe the top of the vial for 30 seconds. And then I will let that dry. And I will take my 3 milliliter syringe, take it off, and I will put 1.5 milliliters of air into the vial. Like so. And then I would extract the right amount of medication that I need. Okay, so I have bubbles, so I'm going to tap and push the bubbles out. Okay, once I have done that, I'm going to check and make sure that I have the correct amount of medication, and I do. So I'm going to, well, I need to show you first, but I'm going to cap it before I show you. Scoop it, cap it, and then see, I don't know if you can see that, it's 1.5. Okay, so then I would take this needle off. Over here. I would put the needle that I'm going to inject it with on, and then take the cap off and make sure that I push the medication to the end of the needle like so, and then I would recap it, scoop the needle, put it back on there, okay, and then I would check the medication again with the MAR after I've finished loading it up. Okay, so now I'm ready to go to the patient's room, so I would gather my supplies, which would be the medication, a sterile swab, and then a Band-Aid or a gauze. Okay, so I would enter into the patient's room, and I would identify the patient by looking at their wristband and getting them to state their name and date of birth. And then I would check the MAR for allergies, and I would also ask the patient if they had any allergies, make sure they match. And then I would check the MAR for the correct medication. Once again, I would wash my hands and put on gloves. I would provide privacy for the patient, and I would also get the patient into the correct position if needed. Then I would take a alcohol swab. I would tear it open. I'm going to do it on the deltoid. So I would need to get their arm ready, and I would tear this open. I would wipe it on there for 30 seconds from the inside out. I would let that dry. I would remove the cap. Okay, you would put the needle in your hand like a pencil in your dominant hand. I'm left-handed. And then after the alcohol dries, you would stick in the patient at a 90-degree angle. Hold the needle with your non-dominant hand. Aspirate just a little bit to see if you have blood in the syringe to make sure you're not in a vein. After that, you would inject the medication slowly. Okay, remove the needle. I would put the alcohol pad back onto the patient to hold pressure, and then I would take the needle and I would put the safety cap onto the needle as so, and then I would discard the needle into the sharps container. I would put the patient back in a comfortable position, the bed low and locked, the call light in reach. I would take off my gloves, I would wash my hands, and I would document that I used a 3 milliliter syringe. I would put that I did 1.5 milliliters of morphine, which is the medication that I used. I would also document the site that I injected the medication in. I would also initial by the time that I gave the medication or any other medications at that time. And I would also document how the patient tolerated the shot, if there was any excruciating pain or if there was excess bleeding, anything like that. And then I would come back in 30 minutes after I've given the medication to assess my patient and make sure that they're showing no signs of any side effects and make sure that the medication is doing what it is supposed to do.